Laura, thank you for that wonderful introduction. And this is a talk after, and thank you, but I'll try to see if I can integrate some of the conversations earlier today to talk about a cell that really has made it to the forefront just within the past 10 years, even though it was the first to be diagnosed, actually discovered, or at least described in the mid-1800s. So I entitled this Strike 3 because it really is a conversation in the between the mast cells, the nerves, and the connective tissue that I think has a tendency to be so problematic in individuals that have a propensity to developing connective tissue disorders. So, whoops. Got a trigger finger, but I am, just for disclosure's sake, I am on Speaker's Bureau for a couple of companies. I really don't mention any of the products that I talk about in that respect. And basically, we're just going to give a journey about how we became so sensitive in modern times. So this is a comment from Platts Mills, Dr. Platts Mills from University of Virginia. So Virginia in the house? All right. And he's basically commenting on how we had such a surgence of hypersensitive disorders basically within the past 60 years. And he basically says the human race has come to dominate its environment so completely that analysis of the increase or appearance of a disease has to take changes in our lifestyle into account. What we eat, what we drink, what we breathe in, and our activities in those environments, and has played a dominant role in the specificity of these diseases, as well as its prevalence and severity. It is clear that we don't understand the consequences. So to try to give you an idea of some of the things that have completely changed our environment, and I'm a native New Yorker, grew up in the Bronx, and I have to tell you, for our other individuals that carry AARP cards in the room, you know that most things that we were eating, ingesting, wearing were basically natural fibers or naturally derived or not manufactured. And within less than 20 years of growing up in the Bronx, everything was either engineered, plastic, exported in, and our bodies are just completely unprepared to deal with all these hypersensitivities. And this is just showing you that because as Americans we spend 90% of our time in rooms like this, we're at an increased exposure to indoor pollutants, personal toiletries, cleaning agents, off-gassing from carpeting, as well as furniture. And this is actually quite irritating to our mast cells, our nerves, which in turn will affect our connective tissue. This is in a sense called the allostatic load, where all these exposures essentially are making us sick. And our body is just reacting to these stressors every minute of every hour of every day. You know, a lot of people focus on eating, and most of us maybe eat 3 or 4, maybe 5 times a day, especially if you have dysautonomia. You drink once or twice or swallow once or twice a minute. You breathe 18 times per minute, and your skin is always exposed to the environment. And it kind of took me back to a place where I used to do experiments with mice. And I can actually make a mouse allergic to cheese. Not all mice, but a good number of them. And we would have to expose them to a toxin and then expose them to what they're allergic to. And so essentially, by adding like cholera toxin or alum or an infectious agent like Mycobacterium tuberculosis, you can make some of these mice chronically sensitive to whatever you wanted to make them allergic to, whether it was pollen, mold, foodstuffs, or harmless substances. And just to run you through a quick experiment, I just want to show you that if you take mice and administer a component from egg called ovalbumin along with some type of a toxin and then reintroduce it, let me see if I can do this. Whoops. I don't know if I can get it back. There it is. You would end up with a eczema-like reaction on the skin. And then when you would just apply the egg, subsequently you would get the same reaction. So now this mouse, who's never had a problem with egg before, will always have sensitivity every time you ingest egg. Same thing can happen with environmental tobacco smoke and pollen or mold, or if you, for foodstuffs, egg, milk, shellfish, but now we're starting to see this progress into other foodstuffs as well. And essentially, you can make several mice strains sensitive to such that they have asthma, eczema, food allergies, and rhinitis. So essentially, it's a model for multiple chemical sensitivity in some respects, where you keep on having these stressors, your body reacts to the stressors to the best of its capacity. This causes more wear and tear. Then you have less resources the next time you have that stress. And essentially, these mice become hypersensitive to the environment that they're in. But again, not all species. So what's the equivalent in the humans? So individuals that have connective tissue disorders seem to be predisposed to having dysregulation of the nerves and the mast cells. And this chronic dysregulation just wears at your vitality. So just to kind of give you an idea regarding timeline, we all start at a certain place, and I have to tell you, younger people are more at risk just because the environment is very different than what your parents grew up into. But you just end up with a new norm that's quite dysfunctional. So to kind of give you some real-world stories, I want to start off with one of the first stories that I encountered almost 10 years ago now, and this is from Dr. John Symes, who's talking about his patients. And he was basically pondering why he was seeing some of his patients end up with cruciate ligament tears, have gastrointestinal distress, have heart murmurs, maybe be at risk at having neurological disorders as well, and some of them were actually predisposed to early cancers. And reading on about Dr. Symes, I was trying to say, well, what patients are you talking about? And he was actually talking about special breeds of dogs. So all of these dogs, and I can tell you, my physician assistant has a Labradoodle, and this dog is, he has a $15,000 bill just to feed, treat all of its hypersensitivity disorders. So here again, certain breeds of mammals are at increased risk for developing chronic hypersensitivity disorders nowadays. So with humans, who's at risk? Again, I would point to individuals that have connective tissue disorders, not necessarily hypermobile type Ehlers-Danlos syndrome. And all of you are providing us with information on how to figure out what is the dysregulation going on with the nerves and the mast cells in the connective tissue. So one of the earliest observations of individuals developing hypersensitivity disorders was actually in 1977. And Dr. Shinnerson had identified, comparing individuals that had allergies who had a connective tissue disorder, particularly Marfan's or neurofibromatosis, compared to other connective tissue disorders who are at greater risk for developing classic allergies. Moving up to 2012, this was a review by Dr. Castori, who's a geneticist from Europe, who also commented that individuals that have connective tissue disorders were at risk for other things other than just musculoskeletal complaints. And this is why individuals that have connective tissue disorders really need to have a team in place, no different than one of these fine running machines for NASCAR. You have to have kind of like a pit crew, a team captain, working with the driver in order to address all the different types of organ systems that can go awry. And at the time, Dr. Castori was speculating or was seeing immune dysfunction, but really couldn't define it. And it turns out it's mast cell dysfunction. These cells are very unusual in that, first of all, you can't really diagnose them with a blood test. You might be able to catch some of their mediators in the blood test, but these are tissue-borne cells. Their job is to guard your borders, your skin, your gut, your respiratory tract, your urogenital tract. In adults, it's about 75 square feet of territory that needs to be monitored year-round. And then these individuals are also known to have dysautonomia in the form of POTS, pain syndromes, chronic fatigue syndrome as well. And so there's, again, something about the dysregulation between these three organ systems, the nervous system, the peripheral nerves especially, the mast cells, sitting in the tissue that's exposed to the environment. So the most up-to-date information we have for a genetic test that might be able to identify individuals that have mast cell dysfunction comes out of the National Institutes of Health. And they were able to identify families that have autosomal dominant patterns, meaning one of the grandparents, one of the parents, and nearly maybe half of the children are at risk for developing this trifecta of disabling syndromes. And this was actually a comment by a woman who finally had an explanation after years of suffering with subluxations. She actually had hypersensitivity to sun exposure, so she had what was called solar urticaria as well. And under certain circumstances, she would become pre-syncopal or actually lose consciousness. So the actual gene that was involved here is an enzyme that's only found in mast cells. And by the way, there are two other enzymes that we really haven't even gotten into, but we do know that individuals that have a tryptase of 6 nanograms or higher. And please understand that we still don't know what a normal tryptase is. So anybody who's been evaluated and was told that they have a normal tryptase, that is incorrect. You actually have to get a baseline tryptase, and then if you have an acute event, it's important to check to see whether or not that tryptase goes up. And if it goes up 2 plus 20%, that is diagnostic for mast cell activation syndrome. So essentially, it is this communication of what your skin, your gut, your respiratory tract, your urogenital tract is seeing, and how your nerves and your mast cells are seeing that environment and responding accordingly. And if you keep on having exposures to biological substances or manufactured substances that have the ability to activate this triad on a perpetual basis, essentially you go from healthy to disabled simply because you've burnt out all of your resources going after things that your body should be ignoring. You've lost tolerance. So to give you an example of somebody who really was suffering for many years, so KL was a 55-year-old woman, and I believe I was allergist number 4 or 5 that had come to see her. So she really had been suffering with chronic hives, and that was her chief complaint. And I have to encourage all of you to kind of take a more global assessment, because we have a tendency to go to specialists who you think is addressing the one problem that bothers you the most. You really need to take a step back and appreciate that the mast cells, the nerves, are throughout the connective tissue. Every single organ system can be impacted. And she was trying to get a different cocktail of oral medications to get her symptoms under control. But in order to get it under control, you have to have a better idea of what's driving your immune system to be so overactive. So we got a little bit more information from her. She had been treated for migraines and headache disorders in the past. She had been treated for asthma as well as rhinosinusitis. She had anxiety, had been hospitalized for some suicidal episodes as well, had irritable bowel syndrome, which really means we couldn't find anything when you had an endoscopy or colonoscopy. But I have to tell you, if you have those type of tests and you're having irritable bowel symptoms, it's important to let the pathologist, or at least the gastroenterologist, know to look for mast cells. Because if you don't ask for that specific stain, you will not see the cells. And then she also complained of fatigue. So essentially, she was seeing all these different doctors for different reasons, and everyone stayed in their corner of the sandbox and weren't talking to each other. But mast cells talk to nerves all the time, nerves talk to mast cells all the time, and it's the connective tissue that takes the hit. There's also a family history that was worrisome for having immune and nerve dysregulation as well. So on physical exam, what you see, if you're able to write on your skin, that's called dermatographism or dermatographia. And I have to tell you, we had a study done at Brigham and Women's, which was a joint effort between the gastroenterologist and the allergy immunology specialists in the IBS clinic. And these were individuals that had IBS for at least 5 to 7 years. If they just scratched their skin, they're like, oh, well, that really doesn't bother me. This is a clue. And many of you in this room are essentially a cold case. So you need to gather as many clues as possible to find out whether or not you have dysfunction of your immune system. She also had evidence of rhinitis, meaning she had hay fever symptoms that still were not controlled. She also said it doesn't bother her at that time. I'm like, okay, I'm just duly noted. She also had some mild distension. So now she has skin involvement, her nose was bothering her, and she had gastrointestinal involvement as well. And it's not really easy to do a quick and dirty test to see whether or not someone's having neuropsychiatric issues, but she had a history of anxiety as well as depression, and actually was quite intolerant to many of the medications that were used, except for, interestingly enough, tricyclic agents. So most allergists follow this algorithm, and I'm sure some of you in the room have had Zyrtec twice a day, Allegra, let's throw on some Singulair. I'll say a prayer too. But understand, you're just trying to suppress the mast cells. The mast cells are trying to tell you something's wrong, and you need to figure out what that is. So a lot of the medications really focus on suppressing either the mast cells themselves or any of the mediators that mast cells have a tendency to release, including histamine. But also they release interleukins that can call in eosinophils and neutrophils. They release nerve factors, so it can irritate your nerves as well. They have a tendency to release factors that can even upset your coagulation cascade. I've had 2 patients so far go into a condition called disseminated intravascular coagulation. So they took a medication, they started to bleed, and they started to clot. It's not a pretty scene. Both of them survived. But it's important to understand that your mast cells, their job is to be the first line of defense. They need to identify what the problem is, identify what resources are needed to control that danger, and then after the danger has been calmed down, their job is to coordinate the healing response. So they're kind of like a superintendent who works in a building. They have to recognize what they can or cannot do. They're hardwired with receptors that your families have inherited from hundreds of generations who are living in certain types of environments. So this is kind of focusing on the fact that most people who have studied medicine, nursing, chiropractor, maybe got 2 lessons first year of training. That's it. So there's a lot of ignorance about what mast cells are. It's unusual. I get that question all the time, what are mast cells? They're not found in the blood, again, so when you get a CBC with ZIF, it's not unusual to see individuals have normal, complete blood cell counts, but again, mast cells are not pictured in a typical blood cell count as well. I don't know if any of you had the fun of going allergy testing. So we did not subject her to allergy testing, but understand that's only one of the receptors that are found on mast cells. So we decided to not give her any guess at that time. Let's get some more information. And if you ask any allergy immunology specialist how many different ways you can cause someone to have hives, these are all the different types of chronic conditions that can be identified in individuals that have urticaria or hives for more than 6 weeks. So we're talking chronic infections, individuals that have different forms of primary immune deficiencies, autoimmune disorders, connective tissue disorders. Interestingly enough, thyroid disease travels with urticaria. So allergists will always check for Graves' or Hashimoto's as a sign of someone having mast cell dysregulation as well. We've been able to identify a couple of individuals that had early forms of cancer. So in many ways, if you have chronic hives, chronic rhinitis, chronic IBS-like symptoms, it's saying something is wrong. You need to get some more details or more testing to see what might be causing your mast cells to go awry so often. And this is just to emphasize that mast cells are found in every single organ system, and these are the different conditions that are associated depending on what your chief complaint is. So here's the thing about, I just went to a urgent care this past weekend, and I was complaining about cough and a urinary system, and he listened to my lungs, he looked at one blood test, didn't look at my nose, and kept it going. So 80% of us have something going on with our nose, and I can't tell you, it's important to understand you breathe 18 times per minute. Your nose is probably your best sensor right after your skin on you being in an environment but that might be not too well for you. So if it keeps on coming and going, you need to evaluate what kind of hypersensitivity reactions are driving, whether it's allergic or not. This is trying to give you an idea of all the physical triggers that can happen to cause your mast cells to start releasing chemicals like histamine, serotonin, interestingly enough, as well as leukotrienes. And if it happens enough times, the mast cells and the nerves start moving closer to each other. So instead of yelling at each other, they just look at each other like SEAL Team 6, saying something's wrong. And so cold, exercise, which is called cholinergic, solar, striking the skin, which is called dermatographism, delayed pressure, as well as some individuals actually even have problems with water striking their skin, which might be a pH issue that's driving the dysregulation of this triad. So these are some of the tests that I typically order after you finish filling out my 20-page questionnaire. It's probably going to get longer now after the 2 lectures I heard this morning. But it's really important after doing allergy testing, or if you had it done before, there's no There's no reason to get it retested again. That tells me that's at least one pathway that's problematic. If you've had an endoscopy or colonoscopy, typically they keep samples. It's important to go back and have them restain and identify whether or not you have too many mast cells or the mast cells have upregulated activation markers or look more spindle-shaped or clustered. We check for various autoimmune disorders, usual suspects such as rheumatoid arthritis and lupus. We definitely check for the presence of infections or risk of infections. You have to understand that when it comes to immune deficiencies, the average time to diagnosis after initial onset of recurrent sinus infections or bronchitis or pneumonia, we had one patient who literally had 18 pneumonias by chest x-ray. And the only way she presented to Mount Sinai was her pulmonologist retired. So it's really important to do a really thorough history. There's the rheumatoid panel, and then also it's important to screen for different types of connective tissue disorders as well as neuropathies. So we took a little bit more history from our patient, and what was interesting is she was getting at least 4 or 5 courses of antibiotics from various doctors that were involved in her care. Her primary care physician, urgent care, her pulmonologist, her ENT, even her dermatologist. She said, "Here, here's a Z-Pak." It's important to understand that this is a global issue. If you focus on the trees, you're definitely going to miss the forest. And so this is some of the testing that we obtain. And you can see that the CBC with a diff up top really is unremarkable. But then you start looking at her total IG level, and I'm like, that's 9. And according to this test, it was normal. But then we looked to see whether or not she had IgE, the recognized common airborne allergens. And you could see she was sensitive to dust mites, mold, as well as pollen. And so having those allergies means that her mast cells stay on DEFCON 1 all the time. We went on to look to see whether or not there was any issues with autoimmune thyroid disorders, and interestingly enough, it was unremarkable, but she did mount an antibody response against her own mast cells. She also had what was called a normal tryptase, so the level here was between 2.2 and 13.2, but the latest data out of National Institutes of Health and also by Gene, who actually does a cheek swab to see whether or not you have a duplication or triplication of the tryptase gene, indicated that she actually had alpha hypertryptasemia. So she had too much tryptase. So when her mast cells were triggered, she would release twice as much. It's like putting a bump stock on an AK-47. It's really important to understand that that enzyme is more than a marker. It had a job to do before it was identifying people with mast cell activation disorders. It has the ability to modify connective tissue, as was seen in the patient who described the fact that her joints sublux all the time. And more importantly, her 4 or 5 courses of antibiotics every year for the I don't know how many years, she had an IgG level of 532, which is 2 standard deviations below the mean. So she wasn't making enough antibodies to fight off usual suspects. Her mast cells tried to compensate the best they could, and she ended up with chronic hypersensitivity reactions as well. So that's why the antihistamines weren't working. Interestingly enough, she was also interviewed by, she actually had been seen by a neurologist 2 years before, had diagnosed her with a neuropathy, but essentially, oops, daisy, but basically said she had no response to medications, which is unusual. It's not surprising, given the fact that she had an immune deficiency, she had a hypersensitivity disorder, and as our first speaker talked about earlier today, a lot of the medications that you use to suppress the symptoms won't work if you don't get at the underlying etiology. So essentially, she was given the diagnosis of fibromyalgia NES, and essentially didn't pursue any further treatment because all the treatments she had used before just were not helpful. I just wanted to point out this one report that came out of Montefiore Medical Center. This is one of the 75 medical centers in the country that actually has allergy immunology in-house. So there is a national shortage of allergy immunology specialists, and just to let you know, out of the 75 so programs in the country, only 3 study mast cells. So typically individuals, allergy immunology specialists that have expertise in mast cell disorders, don't quote me because they'll probably come after me if I share this information, but if they've graduated from Brigham and Women's, Mayo Clinic, or National Institutes of Health allergy immunology programs, they've had some exposure on how to diagnose mast cell disorders. In this case, they found 6 individuals that had immunodeficiency. They went outside their area of expertise, evaluated them for the possibility of having an immune-mediated neuropathy. They either found chronic immune demyelinating polyneuropathy or small fiber neuropathy. I understand that's a little controversial now, but I'm going to retreat to my allergy immunology corner. But I have to tell you, all 6 were found to have anti-GAD antibodies. And they only responded, their symptoms only responded after they were started on IVIG plus or minus Rituxan, which is a medication that will suppress your B cell production, your immunoglobulin production. So she was basically a poster child of all the different ways your mast cells can misbehave and how it could drag your nerves into dysregulation, as well as the connective tissue, because she had chronic hives for over 5 years. And this kind of leads me to a comment that was made by Matthew Hamilton, the gastroenterologist, who first described non-clonal mast cell disorders in the allergy immunology literature. And it says, while the cause or causes of mast cell activation syndrome isn't clear, we have some clues that it might be something to do with the signaling that goes on the mast cell surface, which means the activity that's happening in your skin, your gut, your respiratory tract, and your urogenital tract is influencing the rest of your vitality and health. So these are all the different ways her mast cells were dysregulated. She was having recurrent infections. She was having issues with physical triggers. Interestingly enough, she did have large local reactions to mosquitoes. Understand that mast cells are equipped with enzymes that can break down venom. And if you want to see an interesting video, check out honey badgers and the ability to fight off venom from poisonous snakes. And I am going to just go ahead and just let you know that you can tell your allergy immunology specialist on the cover of Journal of Allergy and Clinical Immunology. There's now a standardized protocol for evaluating individuals that have mast cell activation syndrome. It's basically this checklist. Do you have signs or symptoms worrisome from mast cells misbehaving in 2 organ systems? Do you get better, modest improvement with some mast cell mediated medications? And what kind of test results you have? These are the classic symptoms that are associated with individuals that have mast cell disorders, typically skin, gut, and after that, it's the brain. This is the type of testing that you can have, and the slides are going to be available. But those are the markers that are best identifying mast cell activation syndrome. And these are the medications that are classically used. But again, if you don't respond to these medications, you need to see what else might be driving it. Please rule out other disorders that mimic mast cell activation syndrome, including individuals that may have postural orthostatic tachycardia syndrome. It overlaps that what happens with mast cell dysregulation. It's important to sort out what kind of mast cells, what kind of disorders might be causing your mast cells to be dysregulated. So it could be something broken within, or something that's driving the mast cells to misbehave. And in her case, she had several different things, other comorbid illnesses that were causing her to have chronic hives, chronic rhinitis, asthma, and irritable bowel syndrome, quote unquote. And this is just saying that there are lots of different blocks, but I am going to fast forward. Dr. Cloud did this so much more eloquently. This is just to show you that there's different ways that mast cells can be triggered. And if your mast cells recognize pathogens through the toll-like receptors, you're not releasing histamine or tryptase, so that's probably why histamine blockers won't work. And our treatment of this patient was actually IVIG along with prophylactic azithromycin and continuing her antihistamines. So it's important to screen for mast cell disorders. It's important to screen for the possibility of a dysautonomia condition. With Ehlers-Danlos, this is focusing mostly on hypermobile type Ehlers-Danlos syndrome, but if you suspect you have a connective tissue disorder, please get in the hands of someone who has experience in diagnosing the different connective tissue disorders. And I want to leave it with this statement. I believe that the ultimate power lies within the tissue. When healthy, tissues induce tolerance. When distressed, the tissue stimulates immunity. And continuing down this path, it may also determine the effective class of response. I want to thank you for your attention, and I'm happy to address any questions.
Okay, no problem. So, try and get through them all. When you get mast cell testing and you are on a medication that blocks histamine, will it affect the outcome of the testing?
For the plasma histamine and the 24-hour urine histamine, yes. Not necessarily for the serum tryptase, the prostaglandins test, and definitely not the tissue biopsies. And I have to tell you, the most sensitive test, again, is the tryptase, serial measurements, as well as looking at any affected tissue. We're now even able to identify individuals that have clonal mast cell disorders, meaning they have a mutation, some mutation within the mast cells, by a skin biopsy.
Lots to get through. Is it ever appropriate to be on antihistamines and mast cell stabilizers for life?
I'm sorry?
Is it ever appropriate to be on antihistamines and mast cell stabilizers for life?
We have plenty of data for people using histamine blockers. The tricyclics have been around for 50 to 60 years, so we kind of know the good, the bad, the ugly. There's been some issues with Benadryl, but I have to tell you, we have several patients who are in their 70s, who've been taking Benadryl since they were kids because they never were diagnosed with their mast cell disorders and are doing quite fine. By definition, this is a chronic disorder. You really need to be working with some healthcare professional who understands the journey that you've been on, and also to tailor the medications up or down based on how you're feeling.
If you're having a colonoscopy and endoscopy, is it enough to just ask them to look for mast cells, or do you need to ask for something specific?
So you want to identify the mast cells with specific stains. There are three. One is a marker called CD117. That will light up the mast cells. You can also do a stain for tryptase, which again is only found in mast cells. And then how mast cells were identified back in the 1800s, we didn't have those fancy monoclonal antibodies. We actually just used ink borrowed from the Germans that were staining royalty clothing. So there are some stains, including toluene blue, that will also light up mast cells as well. It's also important to identify whether or not the mast cells are round versus spindle-shaped. So when the pathologist says normal number of mast cells, I'm like, well, can you tell me what they look like? If they're round, that's a good marker. If they are spindle-shaped or clustered, that's worrisome for a mast cell disorder.
Can you comment on the links between Benadryl, long-term use, and Alzheimer's?
Ooh. I have to tell you, that was like a small cohort study. And I have to tell you, I use Benadryl in acute situations. There are other first-generation antihistamines that have been around a long time that are not associated with Alzheimer's. You have chlorpheniramine, which is chlortrimeton. You have clemastine, which was recently identified to help individuals that have multiple sclerosis. You have brompheniramine and cyproheptadine. And hydroxyzine, I almost forgot about that one. And hydroxyzine actually has been used for pediatric anesthesia dating back to, I'm not that old, but the 60s.
What's the difference in total tryptase and mature tryptase?
So tryptase exists as a proform, meaning it's an immature form, and then it gets cleaved into alpha and beta tryptase. When it comes to individuals that have hyper-alpha tryptasemia, they make too much of that form that can predispose them to hypersensitivity disorders. Total tryptase gets all of that. It doesn't break it down between the alpha and the beta forms.
Do allergy shots help or make MCAS worse?
Depends.
Okay.
No, the reason I say that is because, first of all, if you have allergic inflammation but have an immunodeficiency, I've yet to see allergy shots help because you still have an immunodeficiency, right? If you have an autoimmune mast cell disorder, allergy shots are not going to help that as well. And then also understand that there are other substances in the serums other than the antigens that are being administered. We've had individuals have reactions to the bovine serum albumin and preservatives and steroids, because you have to understand those serums are supposed to sit in the refrigerator for 6 months.
Could external and internal recurrent cysts be a symptom of MCAS?
In conjunction with other comorbid illnesses. So we have seen individuals that are more predisposed to having connective tissue dysregulation because the mast cells have the ability to elicit enzymes that can modify the connective tissue. That includes tryptase, chymase, and carboxypeptidase. It not only cystic diseases, but also fibrosis. So mast cells have been implicated not only in tissue defense, but also tissue repair. And dysregulation of that cell population could lead to either end or both.
If you've had GI biopsies that come back negative, does that fully rule out MCAS?
Nope. My guess is they didn't look. It's really important. We have allergy immunology in-house at Mount Sinai, and I have to give my first child to the pathologist to say, can you please just describe what the mast cells look like? So the easiest thing to do is to get those slides obtained if they've been stained for mast cells already, and have them evaluated by a pathologist that has experience in diagnosing mast cell activation syndromes. There's at least 4 centers in the country that are very good at doing that, and you can always have a second opinion.
Do you believe you can have an MCAS without an elevated tryptase level?
Most definitely. Most definitely. And so we had a 5-year-old who had anaphylaxis to sun, and her tryptase was 2, and then she forgot to put on her sunblock. She had anaphylaxis. We were able to catch that blood test within 4 hours, and it went up to 7. So that's diagnostic for mast cell activation syndrome. So if you have a level of 4, you have a bad event, you sometimes have to beg the emergency department or urgent care to look for the tests that they don't know how to spell. And actually, I came up with a lab hack for the practitioners in the room. You can actually ask them, okay, you don't want to order tryptase, that's fine. Can you order a basic metabolic panel? And then I will fax in a script to that lab to add on the tryptase.
Have you found a connection between hormones and mast cells?
So it's been long known. By the way, mast cells have estrogen and progesterone receptors. It's been known for a long time that women first of all, girls starting their menses, and women going into menopause will have increased hypersensitivity. And we also know there's a rule of 3 for women that have hypersensitivity disorders like asthma or urticaria. Going into pregnancy, a third of them get infinitely worse and a third get better. So it's a summation of signals that the mast cell is trying to figure out what it should or should not do.
Could MCAS affect the ability to lose weight?
Ooh, that's a good question. So I would have to say yes. So it all depends on who the mast cells are hanging out with. So there's some initial data that shows that there are 2 different types of fat cells, and if there's any endocrinologists in the room, I'd appreciate any help. But if you have mast cells hanging out with white fat cells, you can't lose the weight. If they're hanging out with brown mast cells, you can't gain weight. So it all depends on what you're predisposed to and what are the triggers that are causing the mast cells to become dysregulated. And also, most individuals, by the time they get to practitioners that are involved in this space, they're in such a chronic fight or flight response that cortisol is running around like crazy. And Dr. Theoharis has shown that they have an accumulation of mast cells actually in certain parts of the brain that will also cause you to have dysregulation of that cortisol ACTH pathway too.
You mentioned 4 MCAS centers. Where are they?
No, I'm just kidding. So I have to tell you, there's about a 2-year wait at most of these places. So Brigham and Women's has one. I believe National Institutes of Health. There is Dr. Afford and myself are both in New York. Mayo Clinic has reopened, and they actually, and very exciting news actually, I'm glad the question was asked. Mayo Clinic is now coming out with a spot urine test instead of a 24-hour urine collection for prostaglandins. So this will help transform the diagnosis of mast cell activation syndrome. The one in Rochester.
What are some lifestyle and environmental changes you can make if you suspect MCAS?
It all depends on what's driving your mast cells to misbehave. If it's straight allergies, you know, you have dust allergy, dust mite covers. If you have animal allergies, which I have along with my 3 dogs, we have air filters and keep them out of the bedroom as best we can. Mold, you got to make sure the water sources are supporting the mold environment, but if it's autoimmune mast cell disorder or infection, you need to kind of address those other factors that are driving the mast cells to be dysregulated.
And to finish, and I know that there's more evidence needed in this area, but in your opinion, can you more clearly explain how mast cell activation could be related to EDS? Okay, so it's a really interesting relationship between mast cells and the connective tissue. So mast cells are born in the bone marrow, and the analogy I often use is a man or woman who joins the police academy. And they get their initial training, they get their basic training, and then they get assigned a community of cells to work. So you can imagine a police officer that's working, you know, 5th Avenue and 42nd Street compared to right outside this door. You have to, in order to meet the needs of that community, you have to understand the community's needs in the first place. So mast cells, after they receive their initial training, they're told to go to the big toe, to the cerebellum, to the elbow, and they have to learn to meet the needs of that particular tissue. So it is the connective tissue where they're assigned that teaches the mast cell what it's supposed to do. So the mast cells that are in my spleen look like the ones that are in my eye, but they have to be able to respond to that community. So the mast cells that have to deal with my breathing in air here is going to be different than the mast cells when I go to Tijuana and have one of the meals. So it's the connective tissue that teaches the mast cells what to do, and then the mast cells have the ability to modify the connective tissue to respond to danger and also coordinate the healing responses. Thank you so much, Dr. Anne Maitland. Thank you.
Thank you.